Good afternoon, Mr. Jones. My name is Esther. I am a student nurse and I'll be working with you today. Before I get started, I'm going to perform 20 seconds of hand hygiene. All right, I've done hand hygiene for 20 seconds. Mr. Jones, can I check your wristband, please? Thank you. Can you tell me your name and date of birth? Stephen Jones, June 10, 1992. Thank you, Mr. Jones. Do you have any allergies, including latex and chlorhexidine? No allergies? Sounds good. So today I will be changing your central venous access device dressing, or CVAD dressing for short. Your CVAD is the tubing that's on your on your chest on the left side, and there's a dressing on it that needs to be changed every 7 days. The last time your dressing was changed was 7 days, so today I will be changing it for you today. It's a very simple procedure. I will prepare my supplies. I'll remove the dressing you have. I'm also going to assess your skin and tubing to see how it's doing, if there's any sign of inflammation or infection, and then I'll put a new dressing on for you. Do you have any questions for me? No questions? Okay. Or concerns? No concerns? Okay. Do you have any pain or discomfort? No pain? All right. So I'm going to do hand hygiene for 20 seconds. Put on my first pair of clean gloves. And now I will use a chlorhexidine wipe to clean the table for 30 seconds, making sure to get the edges. Alright, that's been cleaned for 30 seconds. I will remove my gloves, perform hand hygiene, and allow the table to dry for 2 minutes. While that table is drying, I will inform you, Mr. Jones, that during this procedure, thankfully both you and I are wearing masks. This will help limit any risk of infection from contamination. To also help with this, I will have to ask if you could turn your head during this procedure. This will once again limit any risk of contamination or infection. Could I possibly assist you in turning your head? Thank you. Now that you have your head turned, I will perform hand hygiene and prepare my supplies. I have my extra pack of sterile gloves, which I'll put to the side. I have my bio patch, and I have my dressing kit. I'm going to open the kit. I'm going to remove the mask. Since my patient and I both have masks on, we will not be needing the mask in the kit. I will also grab the outside of the sterile pack. Move that a little bit. I will also take the bio patch and slip it inside. And I see that the blue side of the bio patch is up, and I'm going to dispose of that. All right, Mr. Jones, I will now perform hand hygiene. Mr. Jones, I'm going to remove your old dressing. Please keep your head turned. Are you feeling any pain or discomfort? No? Okay. So now I'm going to assess the current dressing. I see that it's a clear dressing. It looks dry and intact. The dressing was changed 7 days ago. The CVAD has been placed in the left subclavicle vein. I see that the skin does not look inflamed or irritated. I don't see any sign of infection. The catheter is approximately 25 centimeters, which was documented by the previous nurse. And now I will begin to remove the dressing. I'm going to hold the tubing with one hand. I'm going to start at the edge. I'm going to hold the tubing with one hand to secure the lining so that the tegaderm does not tug on the CVAD lining. I will dispose of this. Remove my gloves. All right, Mr. Jones, I have just removed your old dressing. I'm going to perform hand hygiene. Are you in any pain? No pain? Okay. So I see here that as I was removing the old dressing, I can see that there are no cracks or leaks in the tubing. The line is still placed in the left subclavicle vein in the left side of the chest. And the lining is approximately 25 centimeters, and the skin does not look red or inflamed. I do not see any sign of infection, and I see that the patient is not in any pain. Now, I'm going to perform hand hygiene, and I'm going to prepare my sterile gloves. I'm going to make sure as I do this that I do not go beyond the 1-inch border. Second cuff is on. I'll reach the inside and dispose of the packaging. And now I am ready to start. Before I begin, I'm going to fold the back side of the tegaderm so that it's easier to access later on. All right, Mr. Jones, are you in any pain? No pain? Good. I'm going to begin putting on your new dress. I'm going to clean your skin. Please keep your head turned. I'm going to crack the chlorhexidine and clean the site for 30 seconds. All right, I've cleaned the skin for 30 seconds. I am now going to wipe the tubing, which will also be in the upward motion. Once again, I can see that there are no cracks or leaks in the tubing. All right, I have cleaned the skin and the line for 30 seconds. I will need to let this dry for 30 seconds. Now that the line and the site has been dry for 30 seconds, I'm going to still hold on to the line. I have my bio patch blue side up. I'm going to pinch the bio patch like a taco. And place it on. I have my tegaderm. I'm going to make my stress loop. and put the patch on. Making sure it's secure. I'm going to remove the out border for labeling. I have my tape here. I'm going to use this to secure the tubing right there. I have my pen. I'm going to write my initials, the date that it was put on, which is the 23rd, and the time, which is 15:30. I'll remove the label and place the label in a visible place for the next step. I will dispose of my materials, remove my gloves, perform hand hygiene. All right, Mr. Jones, I am all done. How are you feeling? Do you feel any discomfort or pain? No? Good. So I've just finished the procedure. Could I possibly assist you in turning your head back? Thank you. So Mr. Jones, I am all done now. Your dressing has been changed. Your dressing is still clean and intact with the new dressing. Your skin did not look inflamed or red or irritated. I didn't see any signs of infection. The tubing is 25 centimeters. The CVAD is placed in the left subclavicle region, and there were no cracks or leaks in the tubing. And I will document all of this, that it was 25 centimeters and it's in the same place as before, and that you are not experiencing any pain. Do you have any questions for me? No? Okay. Thank you very much for your time, Mr. Jones, and I will check in on you later.